existing operating models been impacted and some of the shifts as a result of the pandemic?
Yeah, it's interesting because, I mean, clearly, if you're running a social care business, it's not high tech, it's very much about people. And people are affected during the pandemic. So I always say, you look at three things. You look at quality. If you haven't got the quality, you haven't got a business. You need to look at the staff you engage with, so the recruitment and retention of your staff. And then following on from that is your revenue, which is your business line. So what's been impacted significantly this year is the impact of the pandemic on the people you employ and also the people you look after. And certainly when you're trying to manage revenue, if that's from private income or it's from local authority income, the whole pandemic has affected the way people work. And so cash flow has been significantly affected due to the speed at which people have been either able to work or have been impacted about their ability to actually get the deal done.
There's a lot to unpack there. What would you say are the fundamental changes that are going to be required in order for operators to survive and thrive coming out of this?
I think it's about being confident in your product. I go back to the point about quality. You've got to have something that people want to buy. So even though we're talking about care, it is still a product. And there's lots of choices that people can make. So therefore, when you're providing care, it has to be the best. You have to be providing something that is a unique selling point. You've got to have a USP like any business. Why choose this care home? Why choose this environment as opposed to another? And it's got to be something about it. It's got to be, generally speaking, the people or the environment or the reputation. And it's important to put yourself into that position of saying, would I want to stay here? It's like going to a hotel, isn't it? You can recommend somewhere, but would you stay in a hotel where you didn't have the facilities that you wanted? We've all got used to nice things in life. And so therefore, it's got to be something that you would want to stay in. Therefore, you want your loved one to stay in as well. But the changes are around how people respond to getting that right. I call it the ABC, the right attitude, the right behavior, and the right culture. And that goes right through an organization. It goes through an organization for the people providing the care and the service, and it goes to the boardroom. Do you have the right attitude in the boardroom? Do you have the right behaviors been exhibited, and do you have the right culture? Because if you've not got quality at the center of your boardroom, it's very hard to tell someone to have quality at the center of what they do in an environment that's providing care. Absolutely. I mean, essentially, simply speaking, in this country, we have two tiers of care homes. We have the luxury self-pay, the new builds, and we've got a massive gulf between that and a budget care home, which is local authority funded. And then there's a whole range of generations in there. So there's a lot of care homes that are still trading that were at one time had another use. They've been converted and they provide a safe environment. They provide a very homely environment, but they're not fit for purpose going forwards. And in fact, during the current pandemic, I've had incredible difficulties in being able to provide a separate area for people to isolate and a big area, a big space for people to come together, but safely, and an area where relatives can come and visit, again, safely. So the new care homes that have been built, and there's quite a few of them being built now, and I'm sure going forward into the future, real estate will have a look at how the optimum look of a care home would be. And I've not had the privilege of going, but I know some people who've taken the opportunity to visit, care homes in North America or in Europe, we've started to learn some of the things that we can do better. Now, the downside of that is the cost of land in this country. So you buy a piece of land, you can buy a piece of land and you can build up like we all do for houses. What you ideally want to do is to build out, but that means you need more land, and therefore there's a greater cost, and you need to recoup that cost through your fees. But the optimum would be a care home that isn't on multiple floors and has a lot of space, both internally and externally. And that would certainly make life easier going through a pandemic.
If you've enjoyed this, please don't forget to like, share and subscribe.